Let's see if you can tell the difference between a regular diaper rash and a yeasty diaper rash. Okay, so I'm trying to keep this as G-rated as possible, but take a look at this rash and tell me what you think. Do you think it's yeast or no? Drum roll, please. This is just regular diaper rash. We call it irritant diaper rash because it's usually due to poop and pee being stuck on the skin for a prolonged amount of time. Sometimes they can also get this from eating new foods that are maybe acidic, like strawberries or oranges, irritates the skin and causes this. How pediatricians can tell is that you see it spares the fold. So when we see a baby, we kind of spread the legs open a bit to get in this fold and see. And if it spares the fold, it's usually just that irritant diaper derm. And in my last video, I talk about how to treat that one. So check that out. Next up is this rash. It's quite red. You can see that it is pretty well defined here, and it does go into the fold some. Another clue with this one is it has these like little dots in the groin area, and we call those satellite lesions. So this is, if you guessed it, yeast. And unlike the previous rash I showed you, where you can just do frequent diaper changes and put a barrier cream on, this one is not going to get better without some kind of antifungal. Now this rash is a little tricky. It is pretty red. Looks like it may be a little bumpy, but this is actually just regular diaper derm. What I kind of covered in this area is that it spares that area, so it's not in all the folds. Now this one is pretty red. We can see it's in the folds, and it also has well demarcated, so sharp edges here, and they look a little bit raised. So if you guess yeast, you're correct. And just to show you a little better, like we talked about before, the satellite lesions are those little bumps kind of outside of the main rash area, and this happens with yeast. And also when the rash extends outside of the diaper area, that happens a lot with yeast. So to do a quick summary, this is our regular run-of-the-mill diaper rash. It's going to be kind of red or pink. It can be smooth, can kind of look like a chapped appearance to it. It does get better within 2 or 3 days of doing barrier creams. And remember that this is typically going to spare the creases. Our fungal diaper rash is going to be more like a beefy red. Remember, it has the satellite spots. It can also extend outside of the diaper. And we're going to see this one more in the folds. And I do typically see this in babies that have oral thrush sometimes, or after they've completed antibiotics for like an ear infection or something else. So those yeasty diaper rashes are caused by a yeast called Candida, and it does require an antifungal to get rid of it. Now you can take your kid to the pediatrician and they can prescribe a topical like nystatin. It comes in a cream or an ointment. If you do the cream, you want to rub it in until it's completely absorbed, and then you're going to put on some kind of barrier cream. Personally, I write the ointment because I feel like it acts as a medication and also a barrier with that ointment. It's kind of like Vaseline on top of it. But if you want to give something a try that's over the counter before making that appointment with the pediatrician, you can try Athlete's Foot Cream. I know this seems crazy, but it has clotrimazole in it, and that is also an antifungal that can kill yeast. And another Athlete's Foot treatment that can be effective is myconazole 2%. Now remember, if you try to use over the counters, they are creams, so you need to rub them in completely before you apply a barrier cream like Desitin or triple paste over the area. So the over-the-counter creams are done twice a day. The nystatin, which is the prescription one, is done 2 to 3 times a day. And yeast is kind of weird. We don't prescribe it for 5 days or 7 days or 10 days. We say to continue it until the rash is completely gone, and then we do it for 2 more days. And as always, if the rash isn't improving in 3 to 4 days, you may want to take your baby in to see the pediatrician, and especially if it starts bleeding, oozing, or crusting, because that could be a sign of a bacterial infection that's treated differently. Remember, if it's in the crease, think yeast. And if you want more tips on diaper rashes, check out my previous video. And if your baby's butt starts looking like this, or they have punched out lesions that are bleeding, go see your pediatrician. I'll do a video on this. It's a little different. So I hope this helps, and thanks for watching.